A major part of our practice is taking care of patients that have undergone significant weight loss, often called massive weight loss patients. Generally, people lose weight via two different methods, whether it be via diet and exercise or a lot of times via weight loss surgery. Patients will often undergo an extensive weight loss very quickly over the first 6 months to a year. Generally, what I like to do is like to see them right about the time they start to stabilize. We traditionally want patients to be stable at their current weight for somewhere around 6 months or so before doing surgery. Occasionally, we'll make exceptions to that depending on the degree of weight loss. When it comes to the variety of different surgeries, I think the most important thing is understanding what has changed with the body after undergoing substantial weight loss. And one of the main things is just that the body has changed with regards to the quality of elastin, and essentially all of that skin just kind of melts off, or in other words, is really saggy. So there are a variety of different surgeries to really help with that. When it comes to the body in particular, there's really quite a few different options. Some patients are really good candidates just for a tummy tuck where they don't have to do a lot of extensive posterior work or liposuction simultaneously because they've lost a lot of weight. But most patients do require more than just a simple liposuction. In our practice, one of the most popular procedures is called the body lift. There are several other names for that surgery: a circumferential tummy tuck, or a lower body lift, or a belt lipectomy, all essentially the same thing. That surgery is absolutely amazing because it gives me as the surgeon just a ton of different options as far as being able to improve the way the trunk looks. So in some patients, we can actually take some of the tissue that we would traditionally throw away and add it into the butt to add more butt volume, because oftentimes with weight loss, we see a lot of loss in volume of butt projection. Additionally, we will often add liposuction to help contour the hips and the waist. In the end, what I usually consider, or what I look for as far as a good result, is a really low incision so that it hides well in the panty line, which can be a problem at times. So the key is keeping that incision really low. When you do that, it really helps to improve the mons, because with extensive weight loss, we often have a lot of loose tissue above the labia and the clitoris. In addition to that, we want a cute belly button, so I encourage you to look at belly buttons. That's an important characteristic of a good tummy surgeon. And then the last thing is all about the shape. And some surgeries can leave patients being a little boxy or lose a little bit of their shape, and that is definitely not the goal for us. We really try to do extensive liposuction and skin removal to help improve the contour.